Hello, my name is Reid Paquet, and today I will be presenting my final presentation for the course MHA 616, Healthcare Management and Information Systems. The implementation of a health information system is a process that needs to be revisited and is constantly evolving. A given health proposal for a health information system must illustrate both positives and negatives of that system's implementation so that those evaluating that system can highlight possible concerns and errors. In order to illustrate that point, we will be reviewing Case 8 from the textbook, Conversion to an EHR Messaging System. The clinic in question for this case is Goodwill Health Clinic. Goodwill Health Clinic is currently utilizing a single call center for patient communication and operates using the Lotus Notes system across all units in their hospital. The problem here is that these calls are received and notes are made on the call system and have to be resubmitted and completely rewritten to input it into the Lotus Notes health system. In order to address some of the concerns for the clinic, there is the proposed solution of a single sign-on patient portal, which would enable physicians and patients to seamlessly communicate, as well as all members of the organization within the clinic itself to have the ability to use enterprise-wide data and allow seamless communication among all aspects of the clinic in terms of helping the patient. When considering the implementation of such a health information system, it is important to have a risk analysis strategy. This strategy recommends and seeks for individuals to highlight the various rules and regulations surrounding that specific health implementation, as well as doing some sort of beta testing. Related to this implementation, we would need to consider any HIPAA violations, specifically HIPAA's privacy rule, related to the use of patient health information, or PHI, and HIPAA rules subarticles 45, parts 160 and 164. These issues all specifically highlight how to confidentially use and maintain patients' health information, as well as ensuring its security. Additionally, when doing a risk analysis strategy, some individuals or management staff members might consider beta testing the product, which in this implementation scenario might be having specific patients go through the process of coming to the hospital or the clinic in this case, and going through their entire process, maintaining the use of the health information system single patient sign-on portal the entire time. After the risk analysis strategy is developed, the system's development life cycle will be evaluated, and this entire process involves planning, selecting, and implementing and evaluating a given healthcare information system. In order for this to work effectively throughout this cycle, a clearly defined goal needs to be established, which will kind of point the organization towards what the final result ought to be, and then from there plan an implementation, and then implement the system, and then obviously and constantly reevaluate that system to ensure that the goal is being what is constantly worked towards. With the implementation of a health information system, such as a single sign-on patient portal, there is a significant increase of communication within any organization, thus drastically impacting the culture that a hospital, or in this case Goodwill Health Clinic, might have. This is because of the seamless passing of data and less time required for individuals in an organization to get caught up to the same information. In order for this single sign-on patient portal's implementation to be successful, there are certain roles and responsibilities that will need to be established. To start, the organization will need to hire a Chief Information Security Officer, also known as a CISO, and they will in turn hire an IT/support staff and train administrative staff and physicians, all individuals who would be using the health information system. In doing so, the Chief Information Security Officer will oversee HIPAA compliance and will be the manager of the support staff, who will in turn ensure hardware and software are completely up to date and will mitigate any risks associated with the handling of patient health information. As previously mentioned, the implementation of this health information system will heavily rely on enterprise-wide data. When it comes to enterprise-wide data, it is important to establish a common infrastructure among all individuals within an organization so that they're both using the same hardware as well as effectively communicating related to that data. Specifically, the governance of enterprise-wide data requires a secure infrastructure and improved communication among all individuals using the system. Additionally, there needs to be present in universal data and a universal format with which that data is presented. And all of the data must be organized well and measured amongst the same standards so as not to single out any sort of data. When it comes to differentiating between technology and enterprise-wide data, it is first important to understand how they are interconnected. Technology is the means with which enterprise-wide data is viewed and manipulated, whereas enterprise data in and of itself is that data that is used by any member within an organization at any level. Without one or the other being technology or enterprise-wide data, the opposite cannot be completely utilized. In order to guarantee that the implementation and continued use of a given health information system is successful, there are certain best practices and policies that are typically referred to within the industry. For purposes of our single sign-on patient portal at Goodwill Health Clinic, the strategy when it comes to hiring those required individuals are related to those roles of a Chief Information Security Officer, as previously mentioned, system analysts and programmers, database administrators, and IT staff members. After those individuals are hired at a reasonable budget, other staffing needs can be met and training can be established throughout the organization so that everybody is up to speed and using the same information and technology. Measuring the economic impact of a proposed health system, in this case the one single sign-on patient portal at Goodwill Health Clinic. One such analytical tool we can use is to perform a cost-benefit analysis. Related to this health system, research suggests that it will be about $599 per user station within the hospital or clinic. By taking the number of physicians as cited in the textbook and the number of overall staff, there's an estimated 1,000 required full-time workstations throughout our clinic at Goodwill. By taking the number $599 per year per station, we have an estimated cost of $599,000 of annual upkeep for the system's implementation. Replacing old systems is one method we can use to dictate if what we are going to spend will justify the means. And all we know from the case study is that they're utilizing a call center. Well, medical call service is an organization that kind of dictates how much per call costs, and the average call for a call center in a clinic is $1.50 per call. The case study noted that there was 1 million annual patient visits, and if we assume one call per patient, there is an annual cost currently being implemented at Goodwill Health Clinic of $1,500,000. If we take that current cost and subtract all of those calls out, as they'll be a part of the new health information systems implementation, there's a total savings of $901,000. This does not bring into context the current systems that are implemented, where there would likely be additional savings by using the systems as they are currently structured, as opposing to purchasing a brand new user station times 1,000. Finally, we have some typical questions that a board of directors might be interested in understanding before a health information systems implementation. The first being, how long would it take to implement the proposed electronic health record single sign-on patient portal? Depending on the system, it might take anywhere between 6 months to a year. In the case of Goodwill Health Clinic, closer to the 6 months. As previously mentioned, there are certain systems already in place that would be absorbed by the new health system implementation, making it much quicker and cheaper to implement the new system. Next, we have any potential unforeseen costs associated that might not have been previously mentioned in the budget. As previously referenced, those options might be related to systems that are currently in place that could either be absorbed or that might need to be completely replaced, any additional training hours that are required, the staff size of the health information systems implementation might need to change in terms of grow or shrink once the system itself is implemented. There are many different factors that could be considered, but for the most part, the $901,000 of proposed savings is a very legitimate number, as previously described. And for our final question related to training required for patients to be able to use and operate the new system, the point of the system's implementation is that it would be very simple and user-friendly, similar to some sort of social media service currently developed. So a lot of people who would be using the health information system and the patient portal would be easily directed and would be quick to understand what the system is requiring of them. There is the opportunity for patients to receive additional training if they so require, and something like that would have to be factored into the budget related to the overall process. If there are any other questions or concerns related to this presentation, feel free to shoot me an email. Otherwise, the references slides will be broken up into what was used for data for this presentation and for figures on 2 separate slides attached at the end of the hard copy PowerPoint. Thank you, and I appreciated my time during this course.